Hey biologists, let's learn about CovidSim. CovidSim is a game where you are the manager of a town. You are the epidemiologist in a town and you get to figure out what's going on and how to protect your town from a COVID epidemic. There's some good information here where the vaccine is. If you want to go to covidsim.com, this is a University of Arizona sim. There's lots of good things to read here. Herd immunity is when a large portion of a population is vaccinated against a disease that can help protect the people who are at risk of the disease but are not vaccinated. When you reach a certain level that enough people are vaccinated or immune by disease, you get to a place where you're not likely to get sick because other people around you, your herd, is not sick. It's the same idea with the flu vaccine. If everyone gets vaccinated with the flu vaccine, people don't get the flu and they don't spread it. Another thing you need to know is R naught. And that sounds very complicated, but it basically is just used to measure the spread of disease. The value is equal to the number of people that an infected person is likely to spread the disease to. And it's affected by how many people are vaccinated, how dense the population is, how many precautions people are taking in terms of wearing masks, washing hands, social distancing, all of that. You know the drill. Vaccine safety is very, very high right now. Vaccine effectiveness, we're going to be able to, it's one of the things that we're going to be able to control in the simulation. And the vaccine waning rate is just like you need to kind of get a tetanus booster every once in a while. People are wondering if you're going to need to get a COVID booster every once in a while, maybe every 6 months, maybe every year, because the COVID virus keeps changing, it keeps mutating, like we've talked about in my class. And when viruses mutate, the antibodies that we've made to a particular virus that we've gotten a vaccine for is a little bit different. And sometimes our antibodies work and sometimes they don't work quite as well. And then over time, we have fewer antibodies. Our memory cells don't remember as well. And our memory of the virus fades. And so we need to get vaccine boosters. Let's go back to the main page here, to CovidSim. The science is here. I'm not going to review all the mathematical formulas. I will show you how to play, so we'll just jump into the game here. We're going to design a city here, and I'm going to pick my town. I live in St. Paul, and my town is smaller than this. It's about 300,000 people here in St. Paul, so I'm going to kind of dial down the population here. And you can imagine your town and the population of your town. This simulation doesn't work below 10,000, so if your town's below 10,000, you're going to have to imagine kind of the next biggest town over. So this is about COVID-19. You kind of know a lot about it. I'm not going to go over so much how it's impacted our lives. Do we want to vaccinate or not? We're going to rely on natural herd immunity. That means people who get the disease and then get over it. It's how the world used to have to deal with chickenpox. There used to be not a chickenpox vaccine, and everybody just had to get chickenpox. And that's how you got immune to chickenpox, and people tended to not get it later in life because they'd either already had it or everyone around them had already had it. So I'm going to say no, just for so we can compare, and that's kind of the whole point of the simulation, so we can compare different conditions without actually having to make a whole bunch of people get sick. So herd immunity, we talked about that. can occur if enough people are vaccinated, enough people get the disease and get over it. But COVID is not really something you can rely on herd immunity, because unfortunately you can get COVID twice. I have a friend whose brother has gotten it twice. He's in healthcare, and they thought you could only get it once and then you'd be done, but no. So, masks, I'm going to say no. I'm just going to say we're sort of like North Dakota right now. Not really doing masks, not really doing much distancing. One of those places that really hasn't taken COVID very seriously. And here's our initial outbreak. I'm going to think like a virus right now. I'm going to think of the best conditions to spread COVID. And so no masks, no social distancing. And I'm going to start with 10 sick people that have come in from a different area. So I'm putting my sick people in here in the densest part of town. And so we're going to hit next here, and we'll be able to see the numbers of infected people, of uninfected people, hospitalized people, people who have died, down here. So watch when I hit play up here. So we're going to play the simulation. We're going to look for the asymptomatic people who are very easily spread COVID. We're going to look for the symptomatic people who know they have the disease and still go out and spread it. The red folks are hospitalized, and the black folks stand for people who have died. And I'm not trying to trivialize anyone who's died of COVID here. Trigger warning for everyone who's lost someone. Yes, there are people who die of COVID in the simulation. It's not graphic. They just show up as black icons here. So down here is all of, you'll see these numbers change as we run the simulation. And I'm going to hit play here, and we'll watch the simulation happen. We'll watch our numbers increase. So you can see kind of people moving around. We have a lot of pink people who are asymptomatic people with COVID who are spreading the disease. And we ended up with about half our population who have the disease and have recovered. We had some people hospitalized. We did lose about 1,400 people, and which is pretty sad. This is what happens if you don't do anything. I'm going to save the simulation here. And now we're going to run again with vaccines. We can't compare outbreaks yet because we don't have anything to compare outbreaks with. This is all my previous data. But we'll compare the two outbreaks we were working on in a minute here. So let's run again with vaccines and see what happens. And this time we're going to get to see infections that we've prevented because we vaccinated people. So we're vaccinating a lot of people here, which is pretty cool. Not many people have contracted COVID. Not many people have died, and we've done a pretty successful job of keeping our city safe just by vaccinating here. So this is a situation with the vaccinations that's pretty similar to St. Paul in real life right now. St. Paul has been very adamant about getting people vaccinated. They've had a lot of public vaccination clinics. There's a drive-through vaccination clinic at the fairgrounds about a mile from my house that's been very busy. People are lined up to get in there. And they've just been trying to vaccinate as much of the population as quickly as possible. The reason they're doing this, the more people who are vaccinated and don't get COVID, the fewer variants there will be. The fewer people who get COVID, that means the virus doesn't get a chance to mutate and make the vaccine ineffective. So getting the vaccine in as many people as quickly as possible will stop the variants and stop people, will stop people getting regular COVID, but also stop more variants forming and more variants spreading. the fewer people who are sick, the fewer people who can spread COVID. So in our simulation where we vaccinated people, only 1,300 people were infected. 172 people were hospitalized. That's pretty reasonable for a town. The hospitals can handle that. 13 people died of infection compared to 1,400 people who died of infection when no one was vaccinated. So we can see here in comparing these two outbreaks, even without masks or distancing, people, just vaccinations saved a lot of lives. So since this is science class, let's try another simulation. Let's try an experiment. We already added the variable of vaccinations. Let's add masks to the mix and see if, in addition to vaccinations, we can save even more lives. So our population is going to remain the same. We're going to have the same virus out there. This is what we had last time. We're going to choose how effective our vaccine rate will be. That's the Pfizer vaccine, which is what I received here in St. Paul, is about 90% effective. So let's go for that. I'm going to choose cloth masks here because that's what most people have access to. And I was responsible last spring for helping make a lot of them for healthcare workers. Surgical is more effective. That's what I wear personally. And these are what healthcare workers wear. We're going to start masks on day 60 for the general population because that's about when they started during the real epidemic. The CDC came out about 60 days into the epidemic here in St. Paul and said, hey, you guys should, everyone should start wearing masks, not just healthcare workers. Choose the portion of your population that actually uses masks. Well, in my neighborhood, it's pretty good. I don't see anyone at the grocery store or any enclosed space. I see lots of people out for walks in parks without masks, but then it's pretty safe. I'm more than 10 feet away from them, so I feel okay about that. So I'm gonna say about 50% because our town's pretty good at this. I don't know about your town. You could set it at a different level for your town. I'm not going to activate distancing because we'll add that next time. So let's see what happens when we just add masks that are only about 25% effective, but we've got about 50% of the population wearing them. So I'm going to hit next. We're going to have the same number of people starting the outbreak. The masks are going to be inactive at the beginning because we haven't set them to kick in until about day 60. So we'll see masks active a little bit later in the simulation. So I'm going to hit play. We can watch some of the numbers run here. Wow, nobody hospitalized. That's pretty good. We did pretty good here. I'm going to save this simulation. I'm going to go down to compare outbreaks. And we only had 377 people infected compared to, even with vaccinations, we had 1,300 people infected. So wearing masks is a really good idea. I can tell you that personally because I have lungs that are very susceptible to colds. I lost some of my lung function. I got a little bit of scarring during pneumonia, and so now I'm very susceptible to getting the sniffles. And I have not had a cold in over a year. It's been amazing not to be sick because people are being responsible, wearing masks and not spreading colds along with COVID. So let's go try another simulation. And this time, let's keep everything here pretty solid. Let's keep our cloth masks and let's activate social distancing. And let's make the start date day. People were pretty good about distancing, even like, you know, maybe 25 days in. Let's call it 30 days in. I remember like going to a bookstore before they closed last March, and people standing automatically 6 feet away from each other, and how weird that was at first, because it felt really rude to like back away from another person. And now it kind of feels the opposite. Like it feels like you're invading someone's personal safety bubble if you stand too close to them. I feel like people in my neighborhood are pretty good about this distancing, although a lot of people do kind of see their friends. But I tend to see my friends outside. If someone visits closely with others outside their quarantine bubble, the bubble has been popped. All right, let's say we'll go down to 15%. Because I do visit a little outside my quarantine bubble sometimes. So I guess I pop my bubble. So here we go. We've got our masks. We've got our social distancing this time. Let's see what happens. Our R naught is down to 0.15. That's pretty tiny. Usually it's around like 1 point something. So vaccinated people are getting vaccinated. Not many people are getting hospitalized. Not many people are getting sick and recovered. Wow, look at that. Super healthy population. When people practice vaccination, when people get vaccinated, they use masks and they social distance. Let's save the simulation, compare it to the others. Wow. Even just with a little bit of social distancing, our infection numbers are just almost half. We're down to 30 people hospitalized and only 2 people died. That's pretty impressive. So if we were able to vaccinate a lot more people, the outbreak would really, really slow down. And that is what other countries are trying to do. The COVID numbers in India right now, as of April, the end of April 2021, are surging, and they're really asking the rest of the world, like, hey, help us out. We need some vaccines. Please send us, please help us develop our own vaccines so we can save our population, because this is really hitting us hard. We don't have enough healthcare here, and we really need your help. So, since part of the assignment here was to do 6 different simulations, 1, 2, 3. So we've done Think Like a Virus, we've done Vaccinate, we've done Add Masks, we've done Add Social Distancing. Let's go back to Thinking Like a Virus. Let's take masks away. Let's take the vaccine away. Let's take social distancing away. Let's take everything away again and see what happens to our population. So let's try another simulation. So no masks. Deactivate masks. Deactivate distancing. And let's go back to Thinking Like a Virus. Let's look at our R naught. Our R naught, when we try to think like a virus and create the perfect conditions for a virus to spread, the R naught, or how easy it is to affect another person, is 1.41. When we had social distancing and masks, it was down to well below 1. It was like 0.15. So you can see a lot of people are getting sick, but they're recovering. And hypothetically, once you get sick and recover, you shouldn't be able to spread it immediately again. We lost a lot of people. 0 people are vaccinated. This is what it was before we had a vaccine. Oops. Gotta save the simulation for it to appear down here. So about half the people were infected. A lot of people were hospitalized, probably overwhelmed the healthcare system, and 1,500 people died of infection. Let's run one more sim so we can get our full 6. This time, let's try to do everything. Let's vaccinate. Let's have it to be 90% effective. Let's do masks. Let's do surgical masks this time. We'll start at day 60, like we did last time with our masks. We'll activate distancing. We'll turn it up to 15% of the population. We'll start on day 30. Our R-naughts back down to 0.15. We'll see both of these become active as we play the simulation. You can see a year go by, and we did really well here. With everything in place, we had 211 people infected. With everything not in place, we had 155,000 people infected. So you can see when you really work hard to stop an epidemic, you can stop it. So if we have the public will and everyone participates and wears their mask and practices social distancing and gets vaccinated, we can keep people safe. Thanks for working with me today. Remember to turn in your assignment.